Medical marijuana is not a self-contained issue, and there are a myriad of smaller issues that have arisen alongside of it. The Oregon Supreme Court ruled earlier this year that medical marijuana patients were still entitled to concealed weapons permits, something the law did not address. But many other issues are still being worked out.
When the medical marijuana statute was passed, it had a reference in it that said this statute does not require any employer to accommodate the medical use of marijuana in any workplace.
One is whether employers should treat marijuana as an illegal substance with drug tests as per federal law, or make allowances for medical marijuana patients.
On the employment side. And that's kind of frustrating for employers because even those who want to do what they can to allow people to use the drug, the ones who don't want to ban it entirely, still have some difficulties managing safety in the workplace because they don't know.
Again, the catch-22 is that the scientific and medical community doesn't know enough about the effects of marijuana to make decisions for the purpose of creating laws regarding issues such as drug tests and driving while under the influence.
I think it's important for employers to understand not only what am I going to do with medical marijuana, but how am I treating other impairing prescription drugs? Because there are a lot of medications, a lot of drugs that employees take under medical authorization, and even if they stay within the scope of the authorization, which might be 2 tablets every 4 hours or whatever it is, they could still have carryover effects in the workplace. So a couple of things that employers need to keep in mind are that marijuana is a little bit different in that since it's illegal and it's plant-based, we don't know what an appropriate dosage is.
Similar issues arise when drivers are suspected to be driving under the influence.
So there's no standardized field sobriety test for marijuana. There is no breathalyzer for marijuana. There is no way to determine the level of intoxication for a driver.
Swale says that even if marijuana was treated like other prescription drugs, there are still inherent difficulties.
But you have to have any patrol officer can do a DUI investigation with alcohol. I mean, that's just something everybody taught in the academy. To do a DUI drugs, you have to have a drug recognition expert, which is a very long course, and they have to maintain their certification every year. And there's not a lot of them out there, and you have to find that individual to come and do this investigation. Maybe get a blood draw, or maybe a urine test. So it is not an easy thing to do, and it's cumbersome.
With its federal classification, significant studies on marijuana don't seem to be on the horizon. However, Braun says there could be other solutions.
But I think if somebody can come up with an impairment test that doesn't focus on this is what's in your body, but focuses instead on how do you react, and we can get away from this whole idea of let's test for a substance, that would really be a wonderful development.
So, Oregonians, keep an eye out for medical marijuana-related initiatives on your ballots and in your legislature. It could be up to you which direction the program will take.